Surprising beetroot side effects you need to know, especially if you're focused on staying healthy. Beetroot, the brilliantly red root that brings color to your salad and juice, has earned a glowing reputation as a superfood. From improving blood flow and enhancing physical performance to lowering blood pressure, it seems like a no-brainer for a healthy diet. But what if this nutritional powerhouse had a darker side? Yes, beetroot offers a wide range of benefits. But for some people, especially those with specific underlying conditions, it can quietly trigger negative health effects that are often overlooked. And here's the problem. Many of these issues develop silently, without clear symptoms, until they've already caused damage. According to the National Kidney Foundation, more than 37 million Americans have chronic kidney disease, and many don't even realize it. That's why understanding how certain healthy foods interact with your unique body is not just smart, it's essential. Beetroot is rich in biologically active compounds like nitrates, betalains, oxalates, and phenolics. These compounds are responsible for the root's well-known benefits, but they also explain the side effects that occur in certain individuals. Let's explore the 8 hidden beetroot side effects you should be aware of, and why paying attention to your body's response is one of the most powerful tools you have for long-term health. Stay with us till the end because the last is one important but often overlooked consideration. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. 1. Beeturia, when your urine turns pink or red. Ever notice your urine turning red or pink after eating beetroot? That's beeturia, a temporary discoloration caused by betaine, a pigment in beets. While often harmless, this effect isn't just quirky. It can be a window into your body's nutrient absorption and digestive health. Normally, your stomach acid breaks down betaine before it's absorbed. But in 10 to 14% of people, the pigment passes through the system unchanged, coloring urine or stool. Here's what's intriguing. Beeturia is more likely in individuals with low iron levels or iron deficiency anemia. Why? Because iron deficiency can reduce stomach acid production, which is needed to break down betaine. In other words, frequent beeturia might be your body's way of flagging poor iron absorption, low gastric acid, or even digestive dysfunction. If you notice beeturia often, especially if you're on iron supplements or managing anemia, consider talking to your healthcare provider. Beetroot itself isn't the problem. It's the biochemical response that may be revealing something deeper. 2. Risk of kidney stones. Beetroot is naturally high in oxalates, compounds that can bind with calcium and form calcium oxalate crystals, the building blocks of the most common type of kidney stones. Around 75% of all kidney stones are calcium oxalate stones. And beetroot, while heart-healthy, can contribute to this risk when consumed in large amounts, especially in juice form. When oxalates enter the body, they are usually excreted through urine. But when too much oxalate and calcium are present at the same time, crystals can form and silently grow into kidney stones over time. This risk is even higher for people with hyperoxaluria, a genetic condition or secondary effect of conditions like Crohn's or gastric bypass surgery. A history of kidney stones. Low calcium intake during meals. If you're prone to stones, limit beetroot consumption, avoid large beetroot juice servings, and pair beetroot with calcium-rich foods like yogurt or cheese. Calcium binds to oxalates in the gut, helping them exit the body before absorption. Also, boiling beetroot helps lower its oxalate content. 3. Blood pressure drops, a hidden risk for certain people. One of the most celebrated properties of beetroot is its abundance of dietary nitrates, which your body converts into nitric oxide. This compound is a natural vasodilator, meaning it relaxes and expands your blood vessels, allowing blood to flow more freely. That's great news for people with hypertension. It eases the workload on the heart and supports better oxygen delivery throughout the body. However, if you already have low blood pressure or are taking blood pressure-lowering medications, beetroot might push things a little too far. When blood vessels dilate more than necessary, your blood pressure can drop too quickly. And if your body can't compensate fast enough, the result may be dizziness, lightheadedness, fatigue, fainting or blackouts, especially after standing up quickly, known as postural or orthostatic hypotension. This is particularly concerning for older adults, individuals with autonomic nervous system disorders, like dysautonomia or Parkinson's disease, or athletes with naturally low blood pressure who supplement with beetroot for performance enhancement. In these cases, beetroot's vasodilating effects may disrupt the body's delicate pressure balance, leading to unexpected weakness or instability. 4. Nitrate sensitivity, an overlooked cause of headaches. While rare, some people are sensitive to nitrates. For these individuals, beetroot can trigger vascular headaches or migraines, similar to how red wine or aged cheese might affect someone who's prone to these issues. How? The sudden dilation of blood vessels, especially in the brain, can alter blood flow and pressure, triggering neurologically mediated pain. It's not dangerous, but it can be very unpleasant and catch people off guard, particularly those using beetroot juice to boost workout performance or mental focus. If you're on antihypertensive medication, have naturally low BP, or are prone to lightheadedness, it's wise to start small. Limit beetroot juice to about 100 milliliters per day, roughly 1/3 to half a cup. Pair with potassium-rich foods, like bananas, or lightly salted broths to help stabilize blood pressure. Monitor how your body responds, especially if you're combining beetroot with other vasodilators. Being proactive doesn't mean avoiding beetroot. It means respecting its potency and adapting it to your personal needs. 5. Digestive distress, a common but underreported reaction. Beetroot is often seen as a gut-friendly food, thanks to its high fiber and antioxidant content. But for some individuals, especially those with sensitive digestion, it can backfire, leading to bloating, gas, cramping, or diarrhea. Why does this happen? Beetroot is rich in FODMAPs, specifically oligosaccharides and polyols. These are fermentable carbohydrates that some people, especially those with irritable bowel syndrome, IBS, or small intestinal bacterial overgrowth, SIBO, cannot digest easily. When FODMAPs reach the large intestine undigested, gut bacteria ferment them, producing gas and drawing water into the intestines. This can lead to bloating and abdominal discomfort, urgent bowel movements or loose stools, a feeling of heaviness or sluggish digestion. Even those without a formal diagnosis of IBS may notice these effects, particularly after eating raw beetroot or consuming large quantities of beet juice. 6. Iron and copper metabolism imbalance. Who should be careful? However, while beetroot's iron-boosting properties help many, there's a critical but less discussed downside for people with hemochromatosis, a genetic disorder characterized by excessive iron absorption. In this condition, the body absorbs far more iron than it needs and, crucially, lacks the ability to effectively excrete the surplus. This excess iron accumulates in vital organs like the liver, heart, and pancreas, potentially leading to severe complications such as liver cirrhosis, heart rhythm disorders, diabetes, joint pain. What makes hemochromatosis particularly dangerous is that it often goes unnoticed for years. Early symptoms like fatigue or muscle aches are vague and frequently attributed to aging or stress. By the time serious organ damage manifests, iron levels may already be dangerously elevated. This is where beetroot's role becomes complex. While beetroot itself isn't extremely high in iron, its vitamin C content enhances iron absorption, not only from beetroot, but also from other foods eaten alongside it. For individuals with hemochromatosis, this enhanced absorption can exacerbate iron overload. People with diagnosed hemochromatosis, or a family history of it, should consume beetroot with caution. Rather than avoiding it completely, moderation is key. Small portions of boiled or roasted beetroot combined with low-iron meals usually present a safer approach. Regular monitoring of iron levels through blood tests is highly advisable to prevent silent damage. 7. Beetroot and blood sugar, the sweet side that demands attention. Beetroot also gets praise for its low glycemic index, meaning it generally doesn't cause rapid blood sugar spikes like refined carbohydrates do. However, this doesn't mean it's free from sugar concerns, especially for people with insulin resistance or diabetes. Take beetroot juice, for example. A single cup can contain around 20 grams of natural sugar, roughly equivalent to the sugar content of a medium banana. Although these sugars are naturally occurring and come packaged with antioxidants and beneficial compounds, when consumed in juice form, where fiber is removed, the sugars are absorbed much faster into the bloodstream. This can cause a noticeable spike in blood glucose, complicating blood sugar control for those with diabetes or prediabetes. Interestingly, beetroot also contains compounds like alpha-lipoic acid, which may improve insulin sensitivity over time. This creates a paradox where beetroot can both support and challenge blood sugar balance depending on the form and amount consumed. To manage this, eat beetroot as part of a balanced meal with protein-rich foods like chicken, tofu, or legumes, and high-fiber vegetables like spinach or kale. This combination slows sugar absorption and reduces blood sugar spikes. For blood sugar management, stick to small portions of cooked beetroot, about half a cup, and avoid large amounts of juice unless you're carefully monitoring glucose levels. Adding blood sugar stabilizing ingredients such as cinnamon, ginger, or chia seeds to beetroot dishes or smoothies can further blunt sugar responses. 8. Beetroot's deep red pigments can mask serious health symptoms. One more important but often overlooked consideration is how beetroot's rich red pigment, betaine, can affect stool and urine color. After eating beetroot, you may notice a reddish or pinkish tint, known as bituria or false hematochezia. While this is typically harmless, it can potentially mask signs of internal bleeding or other gastrointestinal issues. Visible blood in stool can be an early warning for various conditions, ranging from hemorrhoids or anal fissures to more serious diseases like inflammatory bowel disease, IBD, or colorectal cancer. Colorectal cancer is notably the third most common cancer worldwide and a leading cause of cancer-related deaths, making early detection crucial. If you notice red discoloration in your stool after eating beetroot, it usually isn't cause for alarm, especially if it resolves within a day or two. However, if the red color persists without recent beetroot consumption, or if it's accompanied by symptoms like pain, fatigue, weight loss, or changes in bowel habits, it's vital to consult a healthcare professional promptly. Keeping track of your beetroot intake and observing any persistent changes can aid in early diagnosis and avoid unnecessary panic. For most healthy adults, consuming about 1/2 to 1 cup of beetroot per day, whether raw, roasted, or lightly steamed, is both safe and beneficial. Juicing is acceptable too, but should be limited to about 100 to 150 milliliters per day. Combining beetroot juice with lemon juice or ginger not only improves taste, but can also aid digestion and iron absorption without overwhelming your system. If you are prone to kidney stones, avoid pairing beetroot with other high oxalate foods like spinach to reduce risk. Beetroot is undeniably a nutritional powerhouse. However, like all foods, its impact depends heavily on your individual health status and how you consume it. Awareness, moderation, and thoughtful pairing can transform beetroot from a potential concern into a nourishing, health-supporting ally. Try introducing beetroot consciously for a week, whether in salads, smoothies, or soups, and observe how your body responds. If you experience any unexpected reactions, consider discussing them with a healthcare professional. If you found this information helpful, please like, share, and subscribe for more evidence-based wellness tips. Got a personal experience with beetroot, good or bad? Drop it in the comments below. Let's learn from each other. Remember, what nourishes you can also harm you if you're not paying attention. Stay informed, stay empowered, stay healthy. Thank you for watching.